Madam President.
The senator from Indiana.
Madam President, I would like to begin by complimenting my friend and colleague from Arkansas. We entered this body together, and she has consistently advocated on behalf of small businesses, not only across Arkansas, but across the country. We both want to reform the health care system. We know that this has a major impact on small businesses. They create most of the new jobs in our society. So if we care about job creation, we need to care about how health insurance costs affect businesses. They're growing up too fast, and Senator Lincoln has consistently advocated for doing what we can to get those cost increases down and, in fact, lower the burden on our small businesses. So this is not only a health issue, it's a jobs issue, and she's been a real leader for many, many years now. And so, Senator, it's a pleasure to work with you on these important issues.
Well,
our class is doing well.
That's right.
I'd also like to say how much I've been privileged to work with my friend from Oregon, Senator Wyden, who's been one of the most innovative thinkers in the area of health reform. And once again, he's leading the way on an issue that I'm going to speak to for just a second. My colleague from Maine is with us. It saddens me, Madam President, to say that, regrettably, this is one of the few examples of bipartisan cooperation, where we've come together across the aisle, Democrats and Republicans, working together to figure out how, in a practical way, we can help solve the problems that our country faces. Here, we have an issue of what to do about the 7% of Americans who are in the individual insurance market but receiving no subsidies from the government. According to the CBO, they are at risk of having their premiums go up. That's not right, particularly at a time when even people who are making more than $88,000 very often are struggling. So the question was, what can we do about that? Senator Collins, Senator Wyden, and myself focused on these individuals because we want to do what we can, in the words that my colleague from Oregon emphasizes so often, to provide choice and encourage competition to improve both price and quality. That's what our amendments are all about. I'd like to read a very brief statement, Madam President, and then turn it over to my colleagues. Madam President, when I go home to Indiana, the health care concern I hear the most about from ordinary Hoosiers, particularly middle-class Hoosiers, is, what are we going to do to make my coverage more affordable? Many people in my state already have insurance, but they're struggling to keep up with the skyrocketing increases in the cost of that care. We began our health care debate and these deliberations in this body this past spring. In mid-October, months into our debate, some of us were struck by the fact that we have not answered the most basic question. How much is this going to cost, and what can we do to bring those costs down? So I, along with some others, submitted in writing that question to the Congressional Budget Office. What will this do for people in the small group markets like small business owners? What will this do for individuals in the large group markets who work for larger employers? And what will it do for individuals who are out there struggling on their own to provide health insurance for themselves and for their loved ones? When they released their report, I was pleased to see that the current legislation before us would either contain or lower costs for 93% of the American people. 83% of those in small group and large group plans, it's about holding even or modestly lower. For the 17% in the individual marketplace, about 10% of them get, 10 of that 17% get subsidies sufficient to actually bring their prices down, which leaves us with the 7% of those individuals in the individual market who get no subsidies and may see serious cost increases if nothing is done. The Wyden-Collins-Bayh amendments accomplish just that. Our First Amendment promotes more health choices for both employers and workers who would otherwise have few, if any, choices. It would help individuals who would be forced to buy their own insurance at higher rates than they currently pay. It would give them the option to purchase low-cost plans that offer essential basic coverage. It would ensure that Congress does not mandate that anyone buy a more expensive plan than they currently have. Our Second Amendment is a market-based reform that would pressure insurance companies economically to lower premiums and penalize them if they try to raise rates before the new exchanges are fully up and running. It would immediately adjust the insurer fee in the bill to give insurance companies a strong financial incentive to keep premiums down. It would do this by making it economically smart for companies to hold the line on overhead and executive salaries and to root out administrative inefficiencies. Our Third Amendment would offer vouchers to give consumers who have health insurance but aren't satisfied with it access to more choices to meet their health care needs. It would offer vouchers that individuals could use to shop in the new insurance exchanges we're creating. Those who prefer their current plan to what's offered in the exchange could return the voucher and keep their existing coverage. If we pass these amendments, Madam President, we can credibly tell the American people that our long efforts will have addressed rising health insurance premium costs for everyone. And that is at the heart of this effort that we have undertaken. Madam President, in closing, I will say that Americans are not looking for a Democratic solution or a Republican solution to our health care challenge. They are looking for us to come together to pass a reform bill that works in practical terms in their daily lives. More choices, premium cost increases under control, eliminating pre-existing conditions, those are the things that will help middle-class families in my state and others across the country. I am proud that the Wyden-Collins-Bayh affordability package will represent one of the few bipartisan efforts in this body. As I was saying, I regret the fact that it is one of the few, but I'm proud that we have come together to work to address this important challenge. I hope my colleagues will agree that we have a responsibility to restrain premium costs for all American families by encouraging consumer choice and robust competition in the private marketplace. And I hope that we will pass these amendments because they accomplish exactly that. Madam President, thank you for your patience. I yield the floor.
Madam President.